Post-traumatic stress disorder, PTSD, is a mental health disorder that people may experience after going through a traumatic event, such as war, physical abuse, sexual assault, or the death of a loved one. People with PTSD can experience symptoms that last anywhere from 1 month to years after the traumatic event. Common PTSD symptoms include flashbacks, nightmares, and intrusive thoughts that serve as constant reminders of the traumatic experience. Other symptoms include avoidance of situations or objects associated with the trauma, negative changes in mood and behavior, and difficulty controlling emotions. PTSD is treatable through therapy and medication. However, it takes time for people to heal from trauma. Post-traumatic stress disorder, PTSD, is an anxiety disorder that can affect individuals after they have been exposed to a traumatic event. It is important to note that not all people who experience trauma will develop PTSD. However, some may be at higher risk than others. Trauma exposure can include experiencing or witnessing a traumatic event, or having a prolonged stressful experience, such as abuse or neglect. This can lead to the onset of post-traumatic stress disorder, PTSD. PTSD is a mental health disorder that can occur after someone has been exposed to one or more traumatic events. People with PTSD may develop associated physical comorbidities such as headaches, heart palpitations, fatigue, and impaired sleep quality. The long-term effect of PTSD can be difficult to manage without intervention, and treatment plans vary depending on individual needs. If you or someone you know is suffering from symptoms related to PTSD, it's important to seek help from a qualified mental health professional in order to access appropriate treatments. Treatments for PTSD can vary from person to person, but may include psychotherapy and medication. PTSD, or post-traumatic stress disorder, can cause a person to feel overwhelmed and helpless in the wake of a traumatic incident. The feeling of fear and helplessness from the original traumatic event can be triggered by reminders of the event, such as sights or sounds associated with it. Symptoms may include flashbacks, nightmares, and feelings of intense fear, guilt, or shame. People may also experience physical symptoms such as increased heart rate when faced with reminders of their trauma. Acute stress disorder is similar to PTSD, but is shorter-lived and occurs within 4 weeks after the traumatic event. Post-traumatic stress disorder, PTSD, is a mental health condition that can develop after an individual has experienced or witnessed a traumatic event. It is commonly associated with shell shock, battle fatigue, and other terms used to describe the psychological impact of war. Comedian George Carlin famously referred to it as the euphemism treadmill. PTSD can manifest in a variety of ways, but some common symptoms include anxiety, flashbacks, avoidance of certain situations or people associated with the event, nightmares, and difficulty sleeping. Treatment for PTSD typically includes progressive change through talk therapy and/or medications, like antidepressants or anti-anxiety drugs.